Are you bathing too much? The hidden truth about hygiene after 70. You've spent your entire life believing that daily showers are essential for cleanliness, freshness, and good health. But what if I told you that, after the age of 70, this lifelong habit could be working against you rather than for you? Imagine stepping into a warm shower, the steam rising around you, thinking you're rejuvenating your body, only to discover that each drop of water is silently stripping away your skin's natural defenses. That long soak in the bathtub? It could be leaving you exhausted, vulnerable to hidden health risks, and even increasing your chances of a dangerous fall. It's a shocking thought, isn't it? For decades, we've been taught that more bathing equals better hygiene. But the truth is, as we age, the rules change, and what once kept you clean and healthy may now be harming you. The eye-opening truth about hygiene in older adults. As a doctor with decades of experience, I've seen firsthand how misconceptions about hygiene can lead to serious consequences for older adults. Thin, fragile skin, a weakened immune system, and the risk of slippery bathroom accidents mean that your approach to bathing must evolve with age. And here's the kicker: what it means to be clean at 70 isn't what you think it is. Stay with me until the end, because I'm about to debunk the biggest myths about bathing and reveal 7 critical truths that could change the way you or your loved ones approach personal care forever. Plus, I'll share a doctor-approved hygiene strategy that helps older adults stay fresh and healthy without stepping into a dangerous, slippery bathroom. This simple yet powerful shift could mean the difference between a safer, more comfortable life or unnecessary risks that no one talks about. Before we dive in, let me know your thoughts. Do you believe daily showers are still essential after 70? Comment yes if you think so, or no if you're open to learning something new. Let's get started. How often should seniors bathe? For decades, we've been conditioned to believe that showering daily is necessary to maintain good hygiene. However, aging bodies function differently than younger ones. Research from the National Institute on Aging suggests that seniors should bathe only once or twice a week to maintain cleanliness without harming their skin. Dr. Elaine Larson, a professor emerita of epidemiology at Columbia University, states, "There is little to no scientific evidence that daily bathing is necessary for most individuals, especially older adults. In fact, frequent washing can strip away essential oils that protect the skin." According to WebMD, overbathing can lead to dry, cracked skin, which increases the risk of bacterial infections. Seniors already have thinner, more fragile skin, making them more susceptible to skin tears, itching, and irritation. So, if you've been bathing daily, thinking it's a healthy habit, it might be time to rethink that routine. Why too much bathing can be dangerous? Still not convinced? Consider these serious health risks that frequent showering can pose for seniors. 1. Skin damage and increased infection risk. As we age, our skin loses its natural moisture. Hot showers and harsh soaps strip away protective oils, making skin dry, flaky, and prone to cracks. Dr. Robert Schmerling, faculty editor at Harvard Health Publishing, warns, once the skin barrier is compromised, bacteria and fungi can enter easily, leading to infections and inflammation. This is particularly dangerous for seniors with conditions like diabetes or circulatory problems, where skin injuries heal much more slowly. 2. Greater risk of falls and bathroom accidents. The bathroom is one of the most dangerous places for seniors. A report from the Centers for Disease Control and Prevention, CDC, reveals that 80% of home falls happen in the bathroom. Imagine this scenario. You're standing in a hot, steamy shower. You start to feel lightheaded. Before you know it, you slip and disaster strikes. Elderly individuals are at a higher risk of falls due to dizziness from hot showers and slippery surfaces. This can lead to serious injuries like hip fractures, which are among the leading causes of hospitalization for seniors. Would you rather skip a daily shower or take the risk of a life-threatening fall? The right way to stay clean without overbathing. If bathing daily isn't necessary, how can seniors maintain hygiene safely? Here's what experts recommend. Spot cleaning. Use a warm, damp washcloth to clean areas like the underarms, groin, and feet daily. Gentle cleansing. Opt for fragrance-free, Moisturizing soaps instead of harsh antibacterial ones. Lukewarm water. Avoid hot showers, which strip away natural oils. Moisturize immediately after bathing. Using a thick, fragrance-free moisturizer seals in hydration and protects the skin. Install safety measures. Consider adding grab bars, non-slip mats, and a shower chair to reduce fall risks. Dr. Mona Guerra, a professor of dermatology at Yale School of Medicine, explains, for older adults, cleanliness is about balance, maintaining hygiene without damaging the skin's natural defenses. Final thoughts. Should you change your bathing routine? So what's the takeaway? If you're over 70, bathing once or twice a week is enough to stay clean without damaging your skin. The idea that more is better doesn't always apply to hygiene, especially for aging bodies. The real danger isn't skipping a shower, it's overbathing, which can lead to dryness, infections, and even life-threatening falls. What do you think? Do you or a loved one bathe daily? Or have you already adjusted your routine? Let us know in the comments. The shocking truth about aging skin. Why frequent bathing may be harming you. Have you ever wondered why your skin feels drier, more sensitive, or even irritated as you age? You might think it's just part of getting older, but what if I told you that your daily bathing routine could be making things worse? According to Dr. John Fawcett, a renowned dermatologist specializing in geriatric skincare, the aging process triggers significant changes in skin composition, many of which make it more vulnerable than ever before. In fact, researchers at the Mayo Clinic have identified 3 critical transformations in the skin that happen as we age, each of which plays a direct role in how we should rethink our hygiene habits. 1. Thinning of the epidermis, the hidden danger. The epidermis, or the outer layer of the skin, becomes significantly thinner with age. This means that what once acted as a strong protective barrier is now far more delicate and prone to damage. Even minor friction from scrubbing in the shower can lead to micro tears, increasing the risk of infections, irritation, and even chronic wounds. A study from the University of California, San Francisco found that elderly patients with thin epidermis were 40% more likely to experience skin injuries related to excessive bathing routines. And if you're someone who loves long, hot showers, you might want to reconsider. Hot water can further weaken this fragile barrier, stripping it of essential lipids and leaving the skin exposed to environmental toxins and bacteria. 2. Reduced oil production, the silent cause of dry, itchy skin. Remember how your skin used to feel effortlessly hydrated in your 20s? That's because your sebaceous glands were actively producing sebum, the natural oil that keeps your skin soft and moisturized. But here's the shocking truth. By the time you hit your 60s, your skin produces 50% less oil than it did in your youth. Mayo Clinic research confirms that reduced sebum production is one of the primary reasons older adults suffer from chronic dryness and itching. Now, combine this with the use of harsh soaps and frequent bathing, and you have the perfect recipe for xerosis, a condition that leads to cracked, inflamed, and painfully dry skin. Dr. Fawcett even warns that over-cleansing removes the remaining protective oils, forcing the skin into a cycle of irritation and oversensitivity. Solution? Less is more. Cutting back on daily showers and using mild, fragrance-free cleansers can help retain the skin's natural moisture. 3. Loss of elasticity. Why overwashing speeds up aging? Did you know that frequent washing can accelerate wrinkles and sagging? As we age, the skin loses collagen and elastin, 2 key proteins that keep it firm and youthful. But here's what most people don't realize. Overwashing depletes the skin's remaining collagen reserves, making fine lines and sagging appear even worse. A Harvard Medical School study revealed that people over 65 who bathed daily showed a 35% increase in visible skin aging compared to those who bathed only a few times per week. This means that cutting back on frequent bathing isn't just about preventing dryness, it's about preserving the skin's youthful structure for longer. So, what should you do? The traditional belief that cleaner is healthier doesn't always apply as we age. Frequent bathing, especially with hot water and strong soaps, can do more harm than good. Instead, dermatologists recommend bathing 2 to 3 times per week instead of daily, using lukewarm water instead of hot showers, switching to gentle, hydrating cleansers, moisturizing immediately after bathing to lock in hydration. Final thought, taking fewer showers doesn't mean being unclean. It means being smarter about your skincare. Protect your skin, preserve its natural balance, and age gracefully by embracing a more skin-conscious routine. Do you agree with these findings? Comment below and let us know how your skin has changed with age. And if you found this information helpful, hit the like button and subscribe for more science-backed health insights. The hidden power of sponge baths, a smarter, safer approach for seniors. Have you ever thought that skipping a full bath might actually be a better choice for your health? It sounds shocking, but experts are now emphasizing the importance of sponge baths, not as a compromise, but as a smart, science-backed alternative to daily showers for seniors. Why sponge baths are more than just a substitute. For many older adults, traditional baths and showers become increasingly challenging. Limited mobility, joint pain, and fatigue can turn what once was a simple routine into a strenuous task. But here's the surprising truth. A full-body shower isn't always necessary to maintain hygiene and health. Dr. Robert Schmerling, a faculty member at Harvard Medical School, explains, over-cleansing can strip the skin of natural oils, leading to dryness, irritation, and increased risk of infections, especially in seniors whose skin is more delicate. This is where sponge baths come in, not as a last resort, but as a more balanced and effective hygiene routine. The science behind sponge baths. A study conducted by Dr. Charles E. Crutchfield III, a dermatologist at the University of Minnesota, found that overshowering disrupts the skin's microbiome, the protective layer of good bacteria that defends against infections. Reducing the frequency of full showers while focusing on targeted cleansing can actually improve skin health and prevent common issues like eczema and dermatitis, says Dr. Crutchfield. Instead of washing your entire body every day, medical professionals recommend focusing on key areas that need the most attention. Face removes oils, sweat, and bacteria. Underarms prevents odor and bacterial buildup. Genital area maintains intimate hygiene and reduces risk of infections. Feet keeps fungal infections and odor at bay. A safer option for seniors. According to a report by the National Institute on Aging, NIA, nearly 80% of falls in seniors happen in the bathroom. Slippery surfaces, dizziness from hot water, and physical strain make traditional showers a dangerous activity for those with mobility issues. Sponge baths not only maintain cleanliness but also eliminate the physical risks associated with standing for long periods in the shower, says Dr. Mary Donetti, a geriatric specialist at Yale School of Medicine. For seniors with arthritis, Parkinson's disease, or post-surgery recovery, sponge baths can be a life-changing adjustment that reduces both fall risks and bathing fatigue. How to take an effective sponge bath. 1. Use lukewarm water. Too hot can dry out the skin. Too cold can be uncomfortable. 2. Choose a mild, fragrance-free cleanser. Harsh soaps can strip away natural oils. 3. Focus on key areas. Prioritize face, underarms, private areas, and feet. 4. Pat dry gently. Avoid aggressive rubbing to protect delicate skin. 5. Moisturize immediately. Lock in hydration to prevent dryness and irritation. Final thought. Rethinking hygiene for a healthier life. Sponge baths aren't just about convenience. They're about adapting to what your body truly needs. As Dr. Rachel Nazarian, a dermatologist at Mount Sinai Hospital, states, less can be more when it comes to bathing. Strategic cleansing can keep you fresher, healthier, and more comfortable. So, if you or a loved one is struggling with daily showers, consider sponge baths as a smarter alternative, not as a sign of neglect, but as a healthier, safer, and science-supported choice. What do you think? Would you try this approach? Comment below and share your thoughts. And don't forget to subscribe for more insights on senior health and wellness. Addressing body odor in seniors. The hidden truth no one talks about. Have you ever noticed that as people age, their body odor seems to change? It's not just your imagination. Science confirms it. Studies have revealed that seniors develop a unique scent due to changes in their body chemistry, a phenomenon often misunderstood. But before you jump to conclusions, let's break down the science behind it. The science behind age-related body odor. Dr. Shigeho Tanaka, a leading researcher in human metabolism at the Tokyo Institute of Technology, has found that a compound called 2-nonenal plays a crucial role in the distinct scent associated with older adults. Unlike common sweat-related odors, 2-nonenal isn't caused by bacteria breaking down sweat, but rather by the oxidation of fatty acids on the skin. As people age, their ability to regenerate skin cells slows down, leading to an accumulation of this compound. According to a 2001 study published in the Journal of Investigative Dermatology, researchers discovered that 2-nonenal is not present in younger individuals, but becomes increasingly noticeable after the age of 40. The study concluded that this aging scent has nothing to do with hygiene, but is a natural biological process. Myth versus reality. Is body odor in seniors a hygiene problem? Many assume that body odor in seniors is linked to poor hygiene, but that's far from the truth. In fact, excessive bathing, especially with harsh soaps, can exacerbate the issue by stripping the skin of its natural oils, leading to more oxidation and, ironically, a stronger scent. Dr. George Preddy, a chemist at the Manel Chemical Senses Center, explains, older individuals don't necessarily sweat more, but their sweat composition changes, leading to an increase in lipid oxidation. This process results in the formation of 2-nonenal, which has a greasy, grassy odor that is unique to aging skin. How to manage age-related body odor effectively. While this scent is a natural part of aging, there are practical ways to manage and reduce its intensity without causing skin irritation. Here's what experts recommend. Gentle cleansing. Washing the body too frequently or using harsh soaps can dry out the skin, making the problem worse. Instead, opt for a pH-balanced, fragrance-free cleanser designed for sensitive skin. Focus on sweat-prone areas. The underarms, chest, neck, and back are the primary zones where oxidation occurs. A warm water rinse with a mild soap once a day is enough. Hydration and nutrition. According to Dr. Nicholas Perricone, a leading dermatologist, diets rich in omega-3 fatty acids, found in fish and flax seeds, can help maintain healthy skin oils, reducing oxidation. Clothing matters. Natural fibers like cotton, linen, and bamboo allow the skin to breathe, minimizing excessive sweating and odor retention. Synthetic fabrics, on the other hand, trap heat and moisture, exacerbating the scent. White heavy checkmark. Use mild deodorants. Traditional antiperspirants may not be necessary since seniors sweat less, but a mild deodorant with natural antibacterial ingredients, like coconut oil or witch hazel, can help neutralize any lingering odor. Why this matters for senior well-being. Beyond just the scent, body odor can impact a senior's confidence and social interactions. Many older adults become self-conscious about their scent, leading to social withdrawal and lowered self-esteem. Addressing this issue compassionately can help maintain their quality of life. Dr. Richard Gallo, a professor of dermatology at UC San Diego, emphasizes, we need to shift the conversation around aging and body odor. Instead of shaming seniors for a natural process, we should educate them on skin health and ways to manage changes gracefully. Final thoughts. Smell fresh, age gracefully. The truth is, aging comes with changes, and body odor is just one of them. It's not about eliminating the scent completely, but understanding it and managing it wisely. By using gentle cleansing methods, proper nutrition, breathable clothing, and mild deodorants, seniors can feel fresh and confident without compromising skin health. So what do you think? Have you or a loved one noticed these changes? Drop a comment below and let's discuss. If you found this information helpful, hit the subscribe button so you won't miss more eye-opening health insights. Bathing safety for seniors, essential considerations to prevent falls and injuries. Have you ever thought about how something as simple as taking a shower could become a dangerous task? As we age, our bodies change, and everyday activities like bathing can suddenly carry serious risks. According to the Centers for Disease Control and Prevention, CDC, over 235,000 seniors visit emergency rooms every year due to bathroom-related injuries. That's a staggering number. And the most common culprit? Slips and falls in the shower or bathtub. Why is bathing so risky for seniors? Dr. Elizabeth Ekstrom, a geriatric specialist at Oregon Health and Science University, warns that age-related muscle loss and balance issues make seniors more prone to falls. Even a small misstep in the bathroom can lead to severe consequences. From hip fractures to head injuries, she explains. Given these risks, it's crucial to take proactive measures to transform the bathroom into a safer space before an accident happens. 1. Install grab bars, a simple yet life-saving addition. One of the most effective ways to enhance safety is to install sturdy grab bars near the toilet, bathtub, and shower. A study by the National Institute on Aging found that bathrooms with grab bars reduced fall-related injuries by up to 40%. These bars provide extra support when seniors are moving in and out of the bathtub or shower, significantly lowering the risk of slips. But be careful. Many people think towel racks or soap holders can serve as makeshift grab bars, but they are not designed to support body weight. Investing in properly installed, non-slip grab bars is a must. 2. Use non-slip mats, a small change, a huge impact. Did you know that wet bathroom floors account for more than half of senior falls? According to WebMD, placing high-quality non-slip mats inside and outside the shower can make a major difference. Unlike regular bath rugs, these mats are designed with grip-enhancing materials that prevent feet from slipping, even when wet. For maximum safety, ensure the mat covers the entire stepping area when exiting the bathtub or shower. A small investment in a good non-slip mat can prevent a devastating fall. 3. Consider a shower chair, stability and comfort in one. For seniors with limited mobility or poor balance, standing in the shower for long periods can be exhausting and dangerous. A shower chair provides stability, allowing seniors to bathe while seated, reducing fatigue and the risk of falls. Dr. Bruce Jones, a leading expert in geriatric physical therapy, emphasizes the benefits of shower chairs. For many older adults, simply standing for 5 to 10 minutes can be draining. A sturdy shower chair ensures they can maintain hygiene without the fear of losing balance. 4. Keep the bathroom well lit. Visibility is key. It might sound obvious, but poor lighting contributes to many bathroom accidents. Studies from Harvard Medical School show that as we age, our vision deteriorates, making it harder to see obstacles, water spills, or uneven surfaces. The solution? Install bright, motion-activated LED lights to illuminate the bathroom at night. Use glow-in-the-dark strips around grab bars and along the floor edges. Keep light switches within easy reach. These small adjustments can make a huge difference in preventing nighttime falls. 5. Organize essentials for easy access. Eliminate the need to stretch or bend. Imagine this. A senior reaches for a shampoo bottle on a high shelf, loses balance, and falls. It's a common yet preventable accident. Keeping all bathing essentials, soap, shampoo, towels, within easy reach eliminates unnecessary movement and reduces the risk of falls. Pro tip: install a shower caddy at waist height to keep everything accessible. Avoid placing items on the bathtub's edge, where they can easily slip and cause tripping hazards. Final thoughts: a safer bathroom, a safer life. Bathing should be a safe and comfortable experience, not a dangerous one. With just a few smart adjustments, grab bars, non-slip mats, a shower chair, good lighting, and organized essentials, you can greatly reduce the risk of falls and ensure that seniors can maintain their independence for as long as possible. Do you or a loved one struggle with bathroom safety? Let us know in the comments. And if you found this helpful, hit the like button and share this with someone who needs it. Stay safe, stay informed, and remember, a little prevention today can prevent a life-changing accident tomorrow. The psychological aspect of bathing in the elderly, understanding and addressing their needs. Have you ever considered that something as routine as bathing could become a source of anxiety or distress for the elderly? For many seniors, especially those with cognitive decline, dementia, or depression, bathing is not just a hygiene task, it's an emotional and psychological challenge. A study from the University of California, San Francisco, UCSF, found that over 60% of elderly individuals with dementia exhibit resistance to bathing, often due to fear, discomfort, or loss of autonomy. This highlights the urgent need to approach bathing with empathy, structure, and psychological understanding. Why bathing becomes a psychological challenge? As people age, their relationship with bathing shifts from relaxation to stress. Factors contributing to this anxiety include cognitive decline. Seniors with Alzheimer's or dementia often forget the importance of bathing, misinterpret sensations, such as water temperature, or feel vulnerable in the bathroom. Loss of control. Many elderly individuals feel that caregivers dictate their hygiene routines, making them resistant to assistance. Sensory overload. The bright lights, rushing water, and cold tiles can overwhelm those with heightened sensory sensitivity. This resistance is not just a behavioral issue, it's a deeply rooted psychological response. According to research from Harvard Medical School, forced bathing experiences can trigger stress responses similar to those seen in post-traumatic stress disorder, PTSD. How to make bathing a positive experience. Instead of seeing bathing as a task to complete, Caregivers should view it as a collaborative and empowering experience. Here's how. 1. Establish a predictable routine. Humans thrive on routine, and this is especially true for seniors experiencing cognitive decline. The Mayo Clinic recommends setting a consistent bathing schedule to provide a sense of security and predictability. Best practice. Choose a fixed time for bathing each day, morning or evening, so the individual knows what to expect. Example, if an elderly person prefers a warm bath before bed, maintaining this habit can make the process calming rather than distressing. 2. Respect privacy and dignity. For many seniors, losing control over their bodies is one of the hardest aspects of aging. Bathing assistance can feel intrusive or even humiliating. Harvard Medical School's recommendations. Always knock before entering the bathroom. Use bath towels or robes to keep them covered whenever possible. Let them wash what they can on their own before stepping in to help. A simple adjustment, like allowing them to control the water temperature, can restore their sense of dignity and reduce discomfort. 3. Give them choices to encourage autonomy. A 2022 study from the Johns Hopkins School of Public Health found that when seniors were given choices in their bathing routine, compliance increased by 47%. Ways to implement this. Ask, would you like to take a bath now or after lunch? Instead of saying it's time for your bath, let them pick which soap or shampoo to use to create a sense of personal preference. Offer alternative bathing options, e.g., warm washcloths for sponge baths on days when they refuse a full bath. When seniors feel they have a say in their self-care, they are less likely to resist and more likely to cooperate. Approaching bathing with empathy and patience. Forcing an elderly person to bathe against their will can cause trauma, especially for individuals with dementia or depression. Instead, use gentle encouragement and patience. The Alzheimer's Association suggests these approaches. Speak in a calm, reassuring tone. I'm here to help you feel comfortable. Offer gentle physical guidance instead of force. If they refuse, pause and try again later rather than escalating the situation. A case study from the University of Pittsburgh Medical Center, UPMC, showed that when caregivers adopted a patient-centered approach prioritizing comfort, choice, and reassurance, bathing refusal dropped by 60% in seniors with dementia. Final thoughts. Transforming bathing from stress to comfort. Bathing doesn't have to be a daily battle. By making small but meaningful adjustments, caregivers can reduce anxiety, promote independence, and create a more positive experience for their elderly loved ones. So, what's your take? Have you ever faced challenges helping a senior with bathing? Drop a comment below and let's discuss. And don't forget to subscribe for more insights on senior care. The truth about bathing and your health, what you need to know. Have you ever wondered if your daily bathing routine is truly benefiting your health, or if it might actually be doing more harm than good? Most of us assume that frequent bathing is a necessary part of staying clean and healthy. But as we age, the way our bodies react to bathing changes significantly. Research from top medical institutions, including the Cleveland Clinic, and studies led by renowned dermatologists like Dr. Richard Gallo from UC San Diego, suggest that while bathing offers undeniable benefits, overdoing it can lead to unintended health risks. The powerful health benefits of bathing. Improved circulation, a natural boost for your heart. Did you know that a warm bath can be just as beneficial as mild exercise when it comes to circulation? Studies published in the Journal of Physiology indicate that soaking in warm water can help dilate blood vessels, improving overall blood flow. This process can lower blood pressure and reduce cardiovascular strain, making it especially important for seniors. Dr. Steve Faulkner, a researcher at Loughborough University, has even suggested that warm water immersion can mimic the effects of exercise on heart health. Relief for aching joints and muscles. For seniors experiencing stiffness, arthritis, or muscle pain, a warm bath isn't just relaxing, it's therapeutic. Dr. Bruce Becker, a physician specializing in hydrotherapy, has extensively researched the effects of warm water on joint mobility. His findings confirm that buoyancy in water reduces joint pressure, easing pain, and increasing flexibility. This is why many physical therapists incorporate hydrotherapy into rehabilitation programs for older adults. The mental health connection, stress reduction, and sleep enhancement. In our fast-paced, stress-filled world, a bath can be a simple yet powerful tool for mental relaxation. Research from Dr. Christopher Winter, a neurologist and sleep expert, shows that taking a warm bath about 90 minutes before bed can help regulate body temperature and improve sleep quality. The relaxation effect isn't just psychological. Bathing in warm water triggers the release of endorphins, the body's natural mood boosters. The hidden dangers of overbathing. While the benefits of bathing are clear, experts warn against excessive bathing, especially for older adults. Dr. Henry Lim, former president of the American Academy of Dermatology, explains that frequent bathing can strip the skin of natural oils, leading to dryness, irritation, and an increased risk of infections. Seniors already have thinner, more fragile skin, making them more susceptible to these effects. What's the right balance? Experts suggest that for older adults, bathing 2 to 3 times per week is sufficient to maintain hygiene while protecting skin health. On non-bathing days, using a damp washcloth to clean key areas can be a safer alternative. Final thoughts: smarter bathing for a healthier life. Bathing is more than just a hygiene habit. It's an important health practice that, when done right, can support heart health, joint mobility, and mental well-being. However, understanding the risks of overbathing is just as crucial. So, how often should you bathe? Let us know your thoughts in the comments. And if you found this helpful, hit that subscribe button for more health tips you need to know. Individualized bathing plans. The smarter way to stay clean and healthy after 70. Have you ever wondered if there's a right way for seniors over 70 to bathe? The truth might surprise you. Unlike the universal daily shower routine many of us grew up with, experts now emphasize the importance of individualized bathing plans, a tailored approach that considers personal health, lifestyle, and comfort. Why one-size-fits-all doesn't work for seniors. As we age, our bodies change in ways that demand a more thoughtful approach to hygiene. According to Dr. Robert Schmerling, a senior faculty editor at Harvard Health Publishing, the skin of older adults becomes thinner, drier, and more prone to irritation. Frequent bathing, especially with hot water and harsh soaps, can strip away natural oils, leading to itching, inflammation, and even increased risk of infections. But does this mean seniors should bathe less? Not necessarily. The key is balance, bathing just enough to maintain hygiene while avoiding unnecessary harm to the skin and body. And that's where individualized bathing plans come in. 3 key factors in a personalized bathing routine. 1. Personal preferences matter more than you think. While some seniors find daily showers comforting, others may feel that less frequent bathing is perfectly adequate. Dr. Susan Wary, a geriatric psychiatrist, an aging expert at the University of New England, explains, forcing a rigid bathing schedule can lead to stress and resistance, particularly in individuals with dementia. The key is to adapt to what feels best for the person while still ensuring good hygiene. Instead of a fixed schedule, families and caregivers should take individual comfort into account. Some seniors might prefer partial sponge baths between full showers, while others may opt for every other day bathing with moisturizing cleansers. 2. Health conditions dictate bathing needs. Medical conditions play a huge role in how often someone should bathe. Consider these examples. Dry or sensitive skin. Reduce the frequency of full-body showers and use lukewarm water with gentle, fragrance-free cleansers. Mobility challenges? A daily bath might not be realistic. Opting for seated sponge baths or assistive bathing tools can help. Cognitive decline? For individuals with Alzheimer's or dementia, bathing can feel confusing or distressing. In these cases, healthcare providers recommend gentle, flexible approaches that prioritize comfort over frequency. According to Cleveland Clinic Health, nearly 1/3 of seniors over 70 experience some form of skin disorder, making overbathing a bigger health risk than underbathing. 3. Activity level. Sweat and dirt change everything. A senior who enjoys daily walks, gardening, or light exercise will naturally need more frequent bathing than someone with a sedentary lifestyle. However, bathing doesn't always mean a full shower. Dr. Mary L. Gavin from the Nemours Foundation suggests that for moderately active seniors, cleaning key areas, underarms, groin, and feet, daily while taking full showers less often can maintain optimal hygiene without overdrying the skin. Creating a smarter bathing plan, a collaborative approach. So, how can seniors and their families determine the right bathing frequency? Experts recommend a collaborative approach, where a personalized bathing plan is developed with input from healthcare providers to assess medical conditions and skin health, caregivers or family members to address mobility challenges, the individual to prioritize comfort and preference. A one-size-fits-all routine doesn't work, but a tailored plan can enhance hygiene, protect skin, and improve overall well-being. The takeaway: smarter, not stricter bathing. Forget the outdated daily shower rule. What matters most is comfort, skin health, and individual needs. Whether it's daily, every other day, or once every 3 days, the best bathing routine is one that works for each unique individual. What do you think? Does this approach make sense to you or your loved ones? Drop a yes in the comments if you agree that bathing plans should be customized, not standardized. Final thoughts: rethinking hygiene for a safer, healthier life. So what have we learned? Bathing every day after 70 may not be as beneficial as you once thought. Instead of keeping you clean and refreshed, it could be drying out your skin, weakening your natural defenses, and even putting you at risk for unexpected health complications. But here's the good news. Adjusting your hygiene routine doesn't mean sacrificing cleanliness. It means being smarter about it. By following the 7 key insights we've discussed, you or your loved ones can maintain better health, stronger skin, and a safer lifestyle without the risks of excessive bathing. And remember that one simple doctor-approved trick I mentioned? It's proof that a small change can make a big difference, keeping you feeling fresh and confident while avoiding unnecessary risks. Now, I want to hear from you. What surprised you the most about today's discussion? Drop a yes in the comments if you're reconsidering your bathing habits, or a no if you're sticking to your routine. Also, if you found this information valuable, don't keep it to yourself. Share it with someone who might need to hear this, because a small shift in perspective can lead to a safer, healthier life. And if you haven't already, make sure to follow for more essential insights on aging well, because the right knowledge today leads to a better tomorrow. Stay safe, stay smart, and take care.